During my intern year at a county hospital in Los Angeles, I kept this notebook. In it, I wrote down the names of all those who died but shouldn't have. Gloria Espinosa, Javier Arguello, Essence Dean. My mentor, Paul Farmer, taught us to call these stupid deaths. We call them stupid deaths because they're unnecessary. We have cures. We have treatments for HIV. We have cures for TB. For cervical cancer, we can prevent it and cure it and treat it. I wrote down all those who should not have died so as to not forget. Clement Kamanzi, Celeste Mugabo, Augustine Ndizigi. During my work in East Africa, I did the same thing. Many died from newborn pneumonia and diarrhea and malnutrition. I wrote down their names, I said them out loud, so I didn't forget. I wanted to let their names and lives seep into my skin, so I didn't get used to it. To remember that their life is and was as precious as my own. I have spent much of my life as a doctor living and working in resource-denied communities, South Los Angeles and East Africa, but also the Navajo Nation and rural India. In 2014, I co-created an organization called the HEAL Initiative that supports other doctors, nurses, and health workers who want to make serving underserved communities a lifelong commitment. Through curriculum and mentorship and a community of practice, we train and transform frontline health workers. Today, we work across 9 countries, including the Navajo Nation. Here's how it works. We select and pair frontline clinicians who work alongside rural, poor communities in the United States and internationally. These unlikely pairs work together for 2 years. Nurses from Malawi alongside pediatricians from Michigan, or Mexico and Navajo providers teach each other how to integrate indigenous healing into Western medicine. Rwandan and Malian health workers exchange best practices on their community health worker models. In medical school and nursing school, people learn clinical and technical skills. That's important. But the truth is, that's only part of the work. We must understand the context, the challenges, and the reality of the lives of our patients. At the HEAL Initiative, we train our fellows in something else entirely. It's called social medicine, and it widens the aperture of what causes a patient's suffering and how we might alleviate that suffering. We look not just at the symptoms, but the root causes and all the social and political, economic and environmental dynamics that might cause a patient to become sick in the first place. When we write down cholera as a cause of death in rural Malawi, we could just as easily have written down climate change. Why? Because Cyclone Neno destroyed fragile sewage systems and drove cholera deaths across Malawi, including where HEAL works in the Neno district. When we write down a cause of death in Navajo Nation, what we really want to write down is racism. The Indian Health Service is funded at 1/3 the rate of Medicare, despite healthcare being a treaty right for Native Americans. These root causes aren't just intellectually acknowledged by our fellows. Many of them bring lived experiences to bear. Veronica Aragon, our fellow came from Oaxaca on her mom's back at the age of 2. She was expected to become a migrant farm worker. Instead, she became a fierce heel nurse who works in the Central Valley of California. She translated some of the sole sources of COVID information for her community into her native Zapoteco. When Veronica sits down with Haitian heel nurse Graciela, they swap stories on how to elevate nursing in deeply hierarchical health systems, or how to raise families while being deeply committed leaders, or just simply surviving these last ridiculously difficult couple years. Their solidarity restores them for the sacred work ahead. Our fellows at HEAL create what I like to think of as noble friendships across their many differences: geography, language, rank, role. And these noble friendships serve as an antidote to apathy in an unequal world. We have so many metrics for impact at HEAL. Our fellows, nearly 200 of them now, we've trained and graduated, and they'll go on to train thousands more. And at HEAL, our fellows see 80,000 patients approximately in so many poor communities. We fill vacancies in communities with severe workforce shortages. With all those metrics, there's really only one that matters to me most. And it's the hardest and easiest thing in the world. That our fellows never get used to stupid debts. That they never stop imagining eradicating the root cause of disease. Gloria Espinosa, Javier Arguello, Essence Dean, Clement Kamanzi, Celeste Mugabo, Augustine Ndizigi. I carry these names with me. They compel me to do better, to be better. But I also carry other names: Adrian Begay, Emmanuel Bua, Jimena Maza. These are the names of our fellows, and they carry me. They hold a tenderness to loss and a fierceness to fight against the structures that caused that loss. This is what my HEAL fellows and my dear late mentor, Paul Farmer, has taught me. Look suffering in the eye. Keep looking. Show up. Stay together. Thank you.